If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, many experts say a flu pandemic is clearly on the horizon. So the question is, are we ready for a flu pandemic? Now, my guest today says, well, not so much, as he outlined in a New York Times op-ed earlier this week. Joining me now is Michael Osterholm PhD. Dr. Osterholm is the director of CIDRAP at the University of Minnesota. Dr. Osterholm, welcome back to the show, sir.
Thank you, Robert.
Okay, so you titled the op-ed, "We're Not Ready for a Flu Pandemic," and I'll link to it in the show notes if people want to check it out. Dr. Osterholm, why are you so sure that a flu pandemic is in our near or our distant future?
Well, first of all, influenza as an infectious agent goes back almost to antiquity. It surely was around many, many thousands of years ago in avian species, birds, and with some infection of mammals. But clearly, since we've had more modern history, meaning dating back even 1,000 years, influenza pandemics have occurred every so many years, sometimes several decades, sometimes as frequently as once every 10 years. And if you go back through the history books, you can see that while we surely dealt with plague and we dealt with cholera and other kinds of outbreaks like that, influenza pandemics were a part of that. And of course, that occurs when a new influenza virus makes its way out of the bird population, either through another animal species or to humans, and there's a sufficient number of genetic changes in the virus so that when a human actually becomes infected, the virus will actually enter their lung cells, and then more specifically, additional changes occur so that they then can transmit that virus to other humans. And it's when that new bird virus now is readily transmitted between people that we see a new pandemic emerge.
Yeah, in the article, you focus a lot of attention on the issue of vaccines. So, Dr. Osterholm, how are we lacking, and what needs to be done?
Well, first of all, one has to understand the history of influenza vaccines, and we actually provided a very detailed description of that in a report that our center at CIDRAP, the Center for Infectious Disease Research and Policy, did in 2011, where we actually talked about why influenza vaccines ever came to light. And it turns out that the 1918 epidemic, the anniversary, of course, for 100 years is this year, really weighed heavy on the minds of those who were fighting World War II. And they remembered that, in fact, there were 10 times as many deaths in 1918, 1919 due to the pandemic flu than there was all the battlefield casualties combined. And so that at that point they thought, what happens if we have another crowded environment kind of situation with war, and what happens if another flu pandemic emerge? So at that time, the Department of War in the United States was really the lead agency and put together a tremendous effort to try to come up with a vaccine that could be given to soldiers. And they hit upon what they thought were two very key antigens, the hemagglutinin and neuraminidase. And remember, this is in the early days, really, of virology as such, and developed this new vaccine. And for many, many years, people just assumed that that vaccine is developed and grown in chicken eggs was a highly effective vaccine. And in fact, our paper in 2009 in Lancet, which at the time was not a very popular paper, called that into question and said, based on our new analysis, if we look back at those old studies, they grossly overestimated how well these vaccines worked. And at that point, then, we understood that we did have problems. Today, it's a given. People realize the problems with our current influenza vaccines and the fact that we need them. And unfortunately, what I talked about in this op-ed piece in the New York Times was the fact that there really hasn't been the kind of investment in new influenza vaccine work that we desperately need to have effective vaccines, not just for seasonal flu, but also for a pandemic.
So is this part of the reason you point to the current Trump administration as part of the problem? Can you explain that?
Yeah, well, first of all, let me take a step back and say it's not just the Trump administration. I mean, if you look back, we've not had a major initiative on influenza vaccines dating back decades. Now, recognizing that, in fact, it was really only in the 2009-10 time period that people began to understand the inferior performance of the current influenza vaccines. However, we did know, even before then, and it was true in 2009 with the H1N1 pandemic, that the way we make influenza vaccine through largely growing it in chicken eggs, and it takes months to do that in each of the previous pandemics that occurred during the vaccine era, meaning 1957, 1968, and then subsequently in 2009. In each case, the pandemic had largely passed before the first doses of vaccine were ever available. And so not only the question is, does it work, but could it be available? And so it was really around 2009 and 10 we began to understand the nature of our challenges with influenza. But since that time, no government, including the United States, not just the United States, no other organization, including the World Health Organization, others have really identified the critical need for what we call universal or new game-changing flu vaccines. And that's a real challenge for us because today it's going to take a Manhattan-like project. One of the things I commented on in our op-ed piece is this year the United States government, which is just one entity, I might add, not the only one, it should be supporting this, is providing about $70 million in support for new universal flu vaccine research, whereas, the world is putting in $1 billion again this year for HIV vaccine research, which I think is very important, and it has been doing that for years. Why do we not put a similar investment into the flu vaccine area where we desperately need new flu vaccines? And there is some initial science that says we can actually find them.
Now, the next question I found pretty troubling, and I would venture to guess that most of the public is not even aware of this. And you say that U.S. hospitals are woefully unprepared and supply shortages are a danger. Now, Dr. Osterholm, this is America. Why would we run out of supplies in a pandemic?
Well, it's interesting you say that. Just this morning I was reviewing the Emergency Medical Systems drug shortage list, which is a list kept by a group of EMS experts. And there are 54 drugs right now on major shortage or absolutely not available lists. The problem we have today is the business of healthcare is just like business. And what I mean by that is today no one goes and gets an MBA at any kind of business school to talk about how to add more complicated aspects to the supply chain. It's all about simplifying it. It's just-in-time delivery. We don't have warehouses anymore. They largely are on ships, if anything, transporting goods from Asia to the United States. And so if you look, for example, today, most of the critical drugs that we use in this country actually are made in India and China. And there's, in most cases, no stockpiles of any kind. It's just-in-time delivery. And one of the points that we've made over and over again is in this kind of situation, you don't even need a major pandemic to have a problem. Look what's happening right now with saline bags from Puerto Rico, which happened to be a place where most of the saline bags in the world were made. One hurricane basically has caused major global shortages. We can see around the country today, if you read the headlines, there are hospitals in California, elsewhere, that are just having major drug shortages because, again, the system of international production, international global movement of those products is such that it's just-in-time delivery. So now put that on top of a overall preparedness for a pandemic where the whole world is going to be needing all these supplies at one time. And we're going to have major shortages. And that's why I have been critical, for example, of activities like the World Bank's activities to create a pandemic fund, where at the time of the next influenza pandemic or global situation like that, they're going to loan these countries around the world that don't have the money to buy these goods. Well, there won't be any goods to buy. In 2009, when the H1N1 pandemic occurred, one of the major mask respirator companies in the world got over 4 years' worth of orders in 1 week. for which they obviously were never going to fill the vast majority of those because they just didn't have the capacity. So one of the things we have to understand when we prepare for a pandemic is this global impact on manufacturing, trade, and travel. And that is going to overwhelm very quickly into the healthcare system in such a way that the collateral damage from a severe pandemic could be every bit as bad as the actual infectious agent causing the pandemic, like flu. And that's why we have to be better prepared to not have that happen.
Now, is anybody listening to these things that you're saying?
I think a lot of people are listening. But, I look at, for example, when the World Health Organization put together its very important R&D roadmap agenda for vaccines, therapeutics, and diagnostics, which now we have a series of very important infectious diseases for which we're trying to develop the criteria, the background, the reasons for why we need these vaccines and therapeutics and diagnostics, influenza was left off. When the Coalition of Preparedness Innovation, CIPI, came into being, influenza was left off. People have just made the assumption that somebody else is doing it. The private sector says it's the government's job. Government says, well, the private sector philanthropy has to do it. And part of the problem is no one is doing it. And I give credit to the NIH. Tony Fauci and colleagues are surely making this a very important point from the standpoint of publicly identifying it as a critical issue. Yet when you look at the resources they have available to them today, $30 million roughly for this year. When you look at the overall budget of the NIH, that's just a very, very, very small percentage of the NIH budget. If this is really such a major and critical public health issue, why are we not investing much more into this? And to me, that's a really major part of the message of our op-ed piece. We should be.
Right. Now, lastly, what do you see? I don't want to scare the audience any more than I have, but what do you see as the worst case scenario?
Well, it's interesting, Robert, because as we've talked before in this program, in our book, Deadliest Enemies, Our War Against Killer Germs, that Mark Olshaker and I published last year, we actually laid out a very detailed scenario of what an emerging influenza pandemic, like one caused by H7N9, the current strain of flu that we worry about in China, which is infecting humans from chickens. Fortunately, it has not yet been a virus that's changed enough so that humans transmit it to other humans. But about a third of the people who are being exposed to these bird viruses who become infected die. This is a very serious situation, and there's been a number of people who have tried to say to the world, wake up, this could be the next pandemic tomorrow. The pandemic clock is ticking. We just don't know what time it is. And so I think that should one of these agents, like H7N9, become the next pandemic strain of influenza, which there will be one, this could be a real catastrophic event. And, we forget that in 1918, where 52 million people were killed by this virus, and at a time when the world is 1/4 the population it is today. And the fact that they died largely not from secondary bacterial pneumonias, as has been reported by some, but we have increasing evidence that cytokine storms or immune system dysfunction was the primary reason for so many of the deaths. So that means that even having antibiotics today is not going to change that picture. This could be a really serious issue. And so I think that's what we're up against today.
All right. Well, I want to encourage listeners to also check out his book, Dr. Osterholm's book, Deadliest Enemy, Our War Against Killer Germs. And I'll link to that in the show notes also. Dr. Mike Osterholm, thanks again for your time and expertise. It's always a pleasure.
Thanks, Robert. It's always great to do these with you, and I appreciate the public service you provide in doing this kind of work. You really are, by yourself, a very unique gift to all of us in public health.
Oh, thank you very much. I appreciate that. Take care of yourself, sir.
Good.